Hi everybody, my name is Justin. I'm one of the massage therapists at Advanced Spine Joint and Wellness in Medina. And today I'm going to be talking to you about periscapular pain. And periscapular pain is going to be, of course, found around the scapula or the shoulder blade. And what happens is a lot of times people will have internal rotation in their shoulders or forward head posture. And so the muscles around the shoulder blade will have to work a little bit harder to stabilize that area. So muscles like the trapezius, the levator scapula, rhomboids, and then deep to the rhomboids, a muscle called the serratus posterior. All of these muscles help to move the shoulder blade and stabilize the shoulder blade to keep a proper posture. If you have misuse, overuse, it is totally common to develop trigger points in these areas, tender spots. So by using massage therapy, we can help break up any adhesions, scar tissue that's been sitting in there. We can apply pressure and allow the shoulder to move into different ranges of motion to help restore that range of motion, to loosen up the tissues, get healthy circulation flowing through those muscles once again and reducing your pain. As a massage therapist, I like to call the muscles that I just named off the usual suspects. Those are the ones that 9 times out of 10 are driving people crazy and causing them pain. So just by palpating those areas, doing trigger point therapy. So she has a little trigger point right here in what would be her rhomboid muscle. And just by applying some steady pressure, holding it for 30 seconds to a minute, and then feeling that muscle soften, knowing that there's some fresh blood going back into there. And then after that muscle would release, then we could do a little bit of pin and stretch and help get some healthy range of motion back in that area. Another one of those muscles is the levator scapula. This muscle comes off the top of the shoulder blade and actually hooks onto your neck. And oftentimes you'll see people feel like they'll rub here, and if you've been sitting at the computer for a long time or you've been on the phone, you start to get a pain in here. It's usually the levator scapula, can even cause headaches up into the head. And again, just by palpating for that knot and then doing 30 seconds to 90 seconds of trigger point work, and then maybe even doing some range of motion on the muscle to help restore some length back into there and allow for proper muscle function.